annual AMEC Congressional Global Champions Gala 2025.
President Dr. BJP escorting Congressman Danny A. Davis. Round of applause, everybody. Let's keep it up. Let's keep it up. This living legend, Congressman Danny Davis, started this congressional multi-ethnic gala 15 years ago, and he has been doing amazing ever since. So let's give him one more round of applause.
Hello and welcome to Dr. BJP Talk Show.
MedStar Laboratory is one of the oldest and largest independent clinical laboratories in the state of Illinois. MedStar Laboratory is a minority-owned corporation that provides state-of-the-art clinical laboratory services since 1974. Currently at MedStar, we service over 800 medical facilities, including hospitals and assisted living facilities.
MedStar Laboratory's Toxicology Division, Soft Landing Labs, is a leader in drug testing and specializes in servicing behavioral health centers. We pride ourselves in diversity, where 33% of the ownership is women and 80% of the workforce is women. MedStar Laboratory prides itself in accuracy, proficiency, and dependable delivery of quality results by quality professionals.
We provide personalized service around the clock, 24 hours a day, 7 days a week, with professionalism at its best. Thanks to you, we are growing and offering a comprehensive range of diagnostic testing. MedStar Laboratory, your partner for progress and longevity. At MedStar, we treat every specimen as if it was our own.
Okay, welcome to the Global Health Day podcast. We are hosted today by Dr. Daryl Saldana. He is the founder and CEO of MAPS Centers for Pain Management. We are headlined today by Congressman Danny K. Davis, as well as Cook County Commissioner Ms. Donna Miller, who is also the Democratic nominee for the 2nd Congressional District here in Illinois. So congratulations. Thank you. So we are going to begin today with some welcome remarks by Dr. Saldana.
Hello, everybody. My name is Dr. Daryl Saldana. I'm founder of MAPS Centers for Pain Control. We're a multi-location, multifaceted pain management practice focusing on patients with alternatives to opioid management through pain management techniques, including injections and implants. And I really do want to thank everybody for coming here today and seeing our new facility and our expanded facility. I'd like to thank Dr. Vijay Gupta for putting this together, Vijay Prabhakar, sorry, for putting this together. And I would like to thank Second Congressman Donna Miller, not Donna Miller, but elect, I would say, and Congressman Danny K. Davis, a legend. And also, I'd like to thank some of my own staff. I'd love to thank my wife for being here, as always, my wife Ashley, and Stuart Gimble, who's been our in-house counsel for quite some time and has guided us here, and we'd be here. We wouldn't be here without him. And same with Namita Kapoor, our CFO, who we'd be nowhere without her as well. So I do like to thank everybody, and I appreciate everybody for coming and taking a look at our new facility and helping us promote it and just getting to know what this side of the world's about in terms of opioid prevention. Thank you, guys.
Okay. Next, we'll hear from Dr. Vijay, President of the Citizens Action Alliance for Behavioral Health. A few opening remarks.
Thank you so much, Dr. Brandy Jackson. We are all seated here at the Roundtable Dialogue on opioid reduction. And you know, opioid crisis has forever engaged our public health minds for the last decade or so, and still the opioid crisis is a challenge. As the theme of the World Health Day celebration is Together for Health, Stand with Science, we have the experts in the field. The dialogue and the roundtable is headed by none other than Congressman Danny K. Davis, the living legend, who is actually one of the father of the federally healthcare qualified system in the whole of America. He started his career as Secretary of the National Association of Community Health Organizations. He had a checkered political career, having served as an alderman, Cook County Commissioner, and now as a congressman for the last 30 years. We also have with us Congresswoman-elect Donna Miller, who has done some very incredible work in the healthcare system, and that's been her foundation as Cook County Commissioner. Not only that, she is the daughter of a dentist, wife of a dentist and daughter of a physician, and granddaughter of a physician, and her great grandfather, I'm told, had the largest farm in America. So, and that's very much related to nutrition and food for science and food for thought. So, having said that, we thank you all to coming together, and let's have an engaging discussion. We'd like to each of you all introduce your panel, and then back to Brandy Jackson. Brandy Jackson is a psychiatrist. Thank you for taking all the time. She took time off her work to be with us today, and she has worked with several foundations in Chicago area as a clinical director and medical director and a psychiatrist. Thank you so much, Brandy, for joining us.
You. I want to give everyone an opportunity to give their own introductions because there's so much to be said. But I want to also ground us with a few facts about the opioid crisis right now with a focus on the state of Illinois. So we have over 3,000 overdose deaths annually in our state, and the primary driver is fentanyl. So as we have our discussions today, please think about how we can address that particular threat in our state. And I have a lot more to say about that, but before I do, I wonder if we could go around and introduce ourselves. Where to
Go with
start?
Yolanda.
Okay, Dr. Peppers.
Well, hi, everyone. I'm Dr. Yolanda Peppers, and I am absolutely grateful to be here today. I grew up in an area that is still not thought of as a well-to-do area, and that is Inglewood in Chicago. I also had areas of the West Side that I was able to be in. I say that to say, when I grew up, we were told that we were not going to be anything. But as you see today, we all are someone and somebody. And so I'm grateful to be chosen by my friend who I call the commander, Dr. BJ. He commands, and we absolutely say yes because he is a form of justice.
Hello, my name is Stuart Gimbel. I am General Counsel for the Saldana entities, including Midwest Advanced Radiology Center, which is our host today, as well as MAPS Pain Management Practice, and our state-of-the-art ambulatory surgery center, North Suburban Pain and Spine Center. The medical campus is designed to offer interventions to help patients deal with primarily musculoskeletal pain, which leads to the use of pain medication, which leads to pain medication use disorders. So rather than just cutting them off from pain medications, we're trying to give these patients an alternative to help get rid of the pain and solve the problem in the first place. Thank you.
Hi everyone, my name is Rani Yousafzai. Thank you, Dr. VGP, for inviting me to this panel. I have been in healthcare for past 20 plus years. Anything from the geriatrics and the home health side and the medical spa, and also dealing with a lot of hospice patients. And today I also want to focus more on prevention rather than treatment. Sometimes we tend to forget that it's actually better to focus on not getting to the point that we might need opioids. So that's something that I'm excited to discuss with all of you guys today. Thank you.
Cool.
Good afternoon. This is Dr. Vasavi Chaka, Provost of Global Eye International Institute of Leadership. And we promote educational leadership programs. And I'm actually representing our organization here to do the education series on pain management. And also it's very important for all the women. We were talking, having a dialogue with Commissioner Donna Miller, like, the bone density and all those things. We just don't really pay any attention, but bone density and calcium deficiency has a lot of connection with the inflammation and pain-related stuff. So this is a very venue for discussing all those things. And as Mr. Stewart mentioned, this is more like alternative ways of handling the pain instead of just you only using the opioids. And I'm very glad to be here. And thank you, Dr. Vijay Prabhakar, giving me this chance. And he's the one enables all this kind of events. And he leads and creates a path to solutions. And I'm so glad to be here, part of this discussion. Thank you so much. English.
I'm Kathy Thorat, and I am the Executive Vice President of AMEC, that is American Multi-Ethnic Commission, which has been started by our dear Dr. Vijay. And as Dr. Pepper said, that he's the commander-in-chief, and he commands and we listen. So that's how it is. He molds us, he trains us, and I'm so grateful, and I'm so glad that he invited me, and he always makes sure that we are part of this great organization. And at present, I work as a realtor. I sell commercial properties, and my husband and I, we are the directors of the Bible College in India, where we train so many students who have all different, issues, where they go through all these drugs problems, and they come, their lives are changed, they are molded, and we are grateful for that. So thank you for this opportunity.
Thank you. Run.
Good afternoon, everybody. I'm Christian Strawn. I'm glad to be here with Congressman Danny Davis. I'm a senior aide to the congressman, a senior advisor, and I actually used to sell pain management as a former employee with Johnson & Johnson, Janssen Pharmaceutica. In fact, I used to distribute fentanyl as well as Duragesic in particular. So I'm very glad to be here. Thank you, Dr. Saldana, your staff, your team, your wife, and others, and everyone here. I'm very glad to participate on this panel with Citizens Action Alliance for Behavioral Health, spearheading and leading the way. So thank you all, and I look forward to a healthy discussion.
What about your Jamaican connection?
Yes, of course. There is that Jamaican connection. I've had the pleasure of going on a couple of trade missions with the congressman to Jamaica, and also get to volunteer as a chief operating officer for the Jamaican consulate, Chicago, and the Midwest states.
Very good. Thank you.
Thank you, Christian. I'm a public health physician, and when I came to this country in 1983, after doing my certification and master's in public health, I had the unique opportunity, of course, of meeting Congressman Davis. The University of Illinois, the Masters of Public Health School made it mandatory to go to the Federally Qualified Health Center, the first of its kind, which Congressman Davis had started, and Mile Square Health Center, which you all know. And he was there, and he was giving lectures along with the founder of the Mile Square Center. And we had to go there for a whole fortnight. So that's when I first got to hear him and interact with him. And he still got that same youthful young spirit, that fantastic baritone voice of his. And he's still so much what it was right from 1984 days to now. And I got later then I worked with Franklin Boulevard Community Hospital as the Director of Community Health Service for 2 years and structuring their hospital, which P.S. Damone and P.A. Damone started, and then it was sold later. And then I worked with the U.S. Public Health Service in a very interesting assignment. I think that's the best assignment in my lifetime. I worked with the Indian Health Service for the Native American tribes of America and the hidden 500 sovereign tribes. I was the first colored person, first Indian American to be appointed. I served under two presidents, Presidents Ronald Reagan and President George Bush, and I enjoyed those 8 years phenomenal. I used to work 18, 20 hours, which was like since my right through medical school was all in community health and social and preventive medicine. I took a fish to a water, organizing the community, educating them, built clinics, built alcohol and AOD centers for youth centers, daycare, and it was a fantastic opportunity. As you'll recall, AIDS broke out then, 1987. The Rock Hudson was the first public AIDS case, and we were all asked to educate America with AIDS, and the Native American tribes would refuse to think that AIDS would affect them. That was a challenge, but we conquered the challenge, and then the Assistant Surgeon General at that time, Everett Rhodes, assigned me to travel every weekend to all the tribes across the country. I had a plane waiting in Madison. Every weekend I'll take off for 2 days and go and educate the other tribes about AIDS. We presented it in the Amsterdam National Congress of AIDS, and it was one of the best opportunities, and we worked to understand what America is, who are the original landowners of America, and how the white people, I'm looking at Stuart, but I don't mean you or Ashley either, but how they robbed the lands and the treaty rights. It's something fascinating if you look at the Indian history, American history, and how they made sure that if you stayed on the reservation only, you get the benefits. Once you move out to the reservation, you lose your health rights, your education rights, your food, everything. And the wonderful way the white people gave them lovely food full of fat and lard. So they all became obesity was a problem. It was so much ingenuity built into the system. And they gave them free alcohol. So all were drunk, fat, incest, and it was one of the most exciting thing to educate them. And you could see small 8-year-old girls being raped. They had their own judicial system, their own law court, the police, nobody could interfere. And of course I was interviewed in 32 people and I got the job. And every time the Native American tribes were angry with me, the staff, they'll bang the door and go and say, I wish Columbus called us turkeys, because Christopher Columbus, and he came because he called Indians, and because I was an Indian. The Native American tribes, I was in Wisconsin in charge of them. They hated the white people. They hated the black people because they thought the black people took their minority status in this country, and they grudgingly accepted a brown guy like me. But it was one of the most fascinating experiences, and President Clinton honored me with the highest public health award in 1992, the Surgeon General's Award of Excellence. And after that, there was no looking back. I worked with the Chicago Housing Authority, Joe Gardner, because I did a little bit with Mayor Harold Washington. He was an aide and he gave me all the 67 senior buildings in Chicago Housing Authority to do wellness care. And I had it for 3 years. And we did the Wellness Institute, and we had 30,000 Medicare patients. Of course, still, Daryl's dad's good friend Raghu Naik was working with us, and they had Mount Sinai with another group of doctors, and they had to split up the pie. I know. I'm just saying, there's a lot of history, and for me, it's being back here at 9680 Golf Road is reminiscence. I used to know Daryl's dad, John Saldana, very well. I used to come here and spend a long hours with him and we used to have a second floor conference table. He used to spend, and he was one of the greatest trailblazing healthcare entrepreneurs. So for me, it's like coming back home after all these years. Thank you, Daryl and Ashley, for opening and reigniting that connection. Having said that, I'll pass the thing to Dr. Brandy Jackson.
It is an honor to be here with leaders across clinical care, policy, and community spaces. So I'm a clinical psychiatrist, so my work is with the individuals who are struggling, navigating their mental health and substance use disorders, which, as we know, are often co-occurring, and they face substantial challenges every single day. So my view is about the real strengths and gaps in our systems when it gets down to the level of the patient. Today's conversation focuses on reducing opioid-related harm and strengthening behavioral health care here in Illinois. Real solutions happen when policy, clinical care, and community voices are in conversation. So as we begin, I invite us to consider what is working and where are we falling short? And how do we create systems that people can access, trust, and stay engaged in? So I want to begin with Congressman Davis. I want to make sure folks are aware of some legislation that you put forth, the Second Chance Reauthorization Act of 2025. I wondered if you could talk a little bit about that work and how it supports behavioral health services and substance use disorder treatment.
Well, thank you very much, and I am delighted to be here with all of you. I want to thank Dr. and Mrs. Hunt for inviting us and for hosting. I'll put my stick over there. But I want to thank all of us because I believe that health is one of the most important aspects of life. And there's nothing greater than health than life itself. And so I've been fortunate to interact with, get turned on to healthcare. I want to congratulate, first of all, my dear and wonderful friend, Cook County Commissioner Donna Miller, on her movement to the House of Representatives in Illinois. If you win a primary and you're a Democrat, I mean, it's very complete. There's no real effort you've got to go through in terms of the general election. So I'm just going to call her Representative Miller. I've had the good fortune of knowing her father-in-law for many years, David's father. And of course, her husband is an outstanding health practitioner, a dentist. And dentists, when I was a health planner, used to always complain that they were the left end of healthcare, and that after everything else was talked about, then dental health would enter the picture. Right. And I think some of them still feel that way. I have been very fortunate to come in contact with health during the latter part of the 1960s. I've also been fortunate to have been appointed by two presidents of the United States to commissions. One was President Jimmy Carter, who appointed me to a commission to study public health hospitals across the United States of America. And then I was appointed to something by President Bill Clinton before I became a member of Congress. And so I've had two presidential appointments. But I also came into contact with the OEO health programs and went to work for one of the community health centers when there were only 10 in the United States of America. And 3 of those 10 were in Chicago. Now, of course, there are 1,400 of these spread throughout America, serving more than 30,000 patients, 30,000. I don't mean that, 30 million patients all over the country. And I've had the opportunity to visit at least 25 or 30 states where these are located. And so I've visited all over the country the establishment of health facilities and services. I've also been a member of the American Public Health Association. I've been a member of the World Health Association, and I've studied public health in Africa, especially in Kenya, and of course came in contact with the Jomo Kenyatta Hospital I was so interested in all of that till when I came back to the United States, I put a K in my name, and it meant Kenyatta. That's how the K ended up in my name, because I was so thrilled with what I saw and what was taking place and the impact that this leader, Jomo Kenyatta, had on the development, the liberation of his country. And so but health, I always say, is wealth. I know something about pain because in 1979, I had a herniated disc, and I attempted to get out of bed after having won an election to become a member of the city council. And I fell on the floor. And so I've been through these machines that we've seen, but I've managed to live with the pain. It comes and it goes, and pain can in fact be frustrating. And so some pain is physical, but then there's also mental pain, the frustration of everyday life. And there are many, many people who need something to assist or help them. Or if they don't, they think that they do. And of course, they become addicted. I've had the good fortune to work with Dr. Kermit T. Mellinger, who used to be my boss and was one of only 6 African-American psychiatrists in Chicago at that time. His daughter is now a practicing, that is one of them, because he had 4 daughters, but one of them is a practicing psychiatrist as well. So I'm always thrilled to be in the presence of psychiatrists.
One of the few.
But this pain, opiate reduction, opiate use is a big factor in American life. It is also a big problem, and we spend a great deal of time, energy, and effort trying to figure out how do we reduce the feeling of need for usage of external things to help solve what can only sometimes be dealt with internally. That is, we go outside and neglect sometimes inside. And of course, psychiatrists and all these people kind of help us to get inside a little bit. But many of the destructive forces, I recall in the community where I lived, there were 8 people who OD'd on one block a few years ago on the west side of Chicago, around Chicago Avenue in the Austin area. And I'm pleased to know, Representative Miller, that the person who is scheduled to replace me as a member of Congress, LaShawn Ford, has been a leader in organizing opiate task forces on both the west side and the south side of the city to try and get more of a handle on this issue and on this problem. So, Dr. Vijay, I'm pleased to be a part of this discussion and this determination of how do we do that? What becomes the most effective ways I spent most of my life living in what is called the inner city areas. I spent much of my time interacting with low and moderate income individuals and families. The focus of much of my work has been how do you reach down to the real bottom of society and help change those conditions, and how do you change the sense of need that many of the inhabitants, people feel that somehow or another there is something that they are not receiving. There's something that they are missing. And so we have a tremendous responsibility to try and alleviate, I think, that poverty and disillusionment are factors contributing greatly to individuals deciding that they need something beyond self. And when they do that, of course, they create other problems, not only for themselves, but for the rest of society. Nothing solves problems more than dedicated people working on them. Nothing does it. So if I'm in a group with 10, 15, 20, 25, 30 people and they're working, I feel good about that because my historical facts tell me that Sigmund Freud and a few of his friends sat around and tried to figure out how to do something. They invented or created psychology. that they came up with it just kind of out of little groups discussing and meeting. I'm told that Black history really was just some guys who used to sit around and talk about Carter G. Woodson and his friends, probably not as many as they are in this room. They used to meet in the YMCA and talk about what was going on with Black people in America. Next thing you know, they had Negro History Week. Now we got Negro Black History for a whole month all over the country with seminars, with universities, with in-depth studies and all of that. So it's a pleasure to be among all of the experts who are here, who know what to do, how to do it, and why we ought to be doing it. I've never been a physician, but I've been around healthcare. And so I've asked myself, what can I do? And I guess the promotion of awareness, the creation of effort, and of course, yes, many of the individuals who end up in jail, prison, or under the jurisdiction of governmental entities necessitate what we call the need for second chances. And opiate use is actually a big part of the individuals who end up incarcerated, individuals who got to be contained and detained. So the fact that we were able to pass legislation, I must admit that I've been warned that there are efforts to reduce the appropriation that we've been getting now for more than 15 years or so. We probably may not get as much this year, but we have been able to get more than $1 billion appropriated to help those individuals who are in need of second chances, individuals who need help. And that help comes in many ways. So I'll just leave it at that and say that wherever there's a will, there's a way. And the good book we just celebrated, what we call Resurrection Sunday. That is, those of us who believe in the kind of faith in Christianity. And we always say, you can go down, but you can also get up. and that man has the capacity to fall to the deepest depths, but then rise to the highest heights. And I believe that we are constantly rising, and we're going to lick this problem of opiate use and reduce it. So thank you all very much.
I have Dr. Timothy Lubinow here. He's in the middle of solving some of these opiate problems with patients, so I'd like to let him speak and talk about a little bit about what he does from his aspect to help with this problem.
And so my name is Dr. Tim Lubinow. I'm an anesthesiologist and interventional pain specialist. And I brought to our practice here some of the techniques that I've worked on while I was at Rush for many decades. And these are different ways that we can now treat pain through minimally invasive treatment approaches in an outpatient setting in order to improve this issue of chronic pain, to decrease the reliance on opiate medications. I see the persistence of pain as really one of those things that has compelled people to begin on this road to higher and higher opioid use, all for the simple reason of trying to feel better. Over the past decade in particular, we've had more and more of these treatment options come to our space to treat chronic pain. And so this is one of the real advances that we've seen. And with this, in my own individual practice, I've been able to use these new minimally invasive techniques to decrease one's reliance on opiate medicines, come up with important weaning or treatment strategies to decrease opioid use, and also improve quality of life, compel patients to be able to do more activities, not just in the home environment, but also return back to the workforce in some way. And so these are things that we're working on here at the Midwest Center, at the Midwest Anesthesia and Pain Specialist practice here in our outpatient ambulatory surgery center that are really going to make a big deal. So we're bringing cutting-edge therapies that have previously been just relegated to the bigger academic institutions back down to the grassroots level, so people can make use of these in a more simpler and straightforward fashion.
Thank you. Thank you so much. And thank you for your service. I don't know how many people on the panel know this, but my husband is a United States Marine veteran who served in Operation Iraqi Freedom. He sustained injuries during combat, which required extensive rehabilitation. 2 Purple Hearts, very proud of him. But yeah, he likes to tell me he met Michelle Obama while he was there, so anyway, in the hospital. But his journey towards recovery, mental and physical, did lead him to overutilize, ultimately, opiate medications. And now he's 2 years completely sober after a very long journey. But we often talk about how, yes, thank you. But we often talk about how he received these medicines from a physician, took what he was told, felt that he was doing everything right, only for the entire situation to snowball. So I'm curious, for the clinicians in the room, how do you go about in your practice balancing the need to decrease pain, to to literally do no harm to help people feel better with that ever looming threat of addiction. And give us a window into your mind about how you approach that.
So every patient is different. You can't go through a strict protocol saying, I would wean a pill every other day. There's patients with different situations, different work situations, different life situations, different stress situations. But overall, they have to be compliant with a program that weans. You can't say next month, and then, the other thing is we do urine toxicology screens. So if they're on different illicit drugs, it just you can't ethically prescribe somebody oxycodone while they're on cocaine. Marijuana is a whole different story these days, but these different methamphetamines or different other opioids, illicit opioids, you can't be taking them concurrently while being prescribed. First of all, that's just malpractice on the part of a physician, and second of all, it's and more importantly, it's dangerous for the patient. So every patient is different. As long as they comply and they're not using any illicit drugs, we can work with them. Say 1 month they just need to stay on the current regimen, and they're willing to wean the next month, then we're okay with that. Everybody can't just be like, okay, this protocol that's set for everybody, it doesn't work for everybody, because everybody's life is different, everybody's pain is different, everybody's needs are different, and everybody's social situations are different. So as long as they're not using anything illicit, we're very willing to work with them.
Thank you. Thank you so much. Are there any other clinicians in the room who want to weigh in on this? Maybe Dr. Peppers? Dr. Peppers?
Well, I was so excited. I forgot to share because I was in the presence of Dr. V and Ms. Miller and Congressman, but my doctorate is in clinical psych. I am also a registered professional nurse. I did say professional. We are professional. And I'm a certified addiction drug counselor. And just as you said, doctor, every person, every patient, every client, every resident, everyone is an individual, and their plan of care must be treated as an individual, not that you have this much money or no money. Every plan of care has to be individualized, and that is how we help our patients come from one area to a lesser area of what we prescribe for pain.
Thank you so much. Appreciate that. And Mr. Gimbel, you're the CEO of the North Suburban Pain and Spine Surgery Center. And so I'm curious about your perspective as a CEO, as a chief executive. What do institutions need to do to meet the need right now when it comes to this opiate crisis?
Good question.
That's a good question. Well, the first thing I'd point out is it's not enough to say stop using pain medications, right? As long as there's going to be pain, there are going to be loved ones, spouses, children, friends who are in pain, and it's very difficult to tell those people, just suck it up and deal with your pain. What we're doing at NSPS is we're trying to provide an alternative, an option, a way out of the cycle of pain. Like Dr. Lubinow was saying, the types of procedures that they're doing these days to treat pain, both from a pain management standpoint, as well as our orthopedic surgeons, podiatrists, and world-class spine surgeons, is getting, hopefully, to the root of the problem, and that is to try and come up with a way of alleviating the pain without becoming reliant upon pain medications.
Very well said.
Thank you so much. Thank you so much. And Mr. Strong, I am so curious about your perspective as a person who used to help dispense or sell these substances. What do you think about that work now in hindsight? And what perspective has you gained from being on that side of the supply?
So, thank you, Dr. Jackson. I think in hindsight, I look with a bit of guilt, possibly. But in all honesty and fairness, I think at the time when we were selling or giving out prescriptions for people in need, it was really more so to address overwhelming amount of urgency for addressing the needs for patients that really had a problem dealing with day-to-day pain. And I think there was a lot of willingness on behalf of a lot of physicians and caregivers to address and try to alleviate, the symptoms of pain so that people could live normal lives and just have some form of quality of life. In hindsight, we all know that there should have been, some more safeguards, and then looking at what would be the outcomes of overprescribing or not monitoring, different distribution systems. But I think where we're at right now is pain doesn't go away, and neither do the lapses in human oversight for how we address some of our everyday problems. So, in hindsight, I think it's also looking forward that we've got to be very careful, very present, and also future forward thinking about how we're addressing some of our problems for today, and being very careful about what that outcome is going to be for tomorrow. So I don't know if that answered or went to the point of it, but I think it's a starting point for us to deal with the present issues of today, and then kind of take a look back and see how we can chart out where we should go from here.
Good. Thank you. And I'm so happy to hear you put that perspective on it about eliminating or minimizing pain, because I think it's easy to malign the producers of opiates as these supervillains, and but the reality is, for people who live in pain every day, this, for many of them, is their last option to even basically function or feel like they can get out of bed. So we can do everything we can to eliminate the use or decrease the use of opiates, but we must also ask ourselves, what about the pain that remains? I want to turn to Congresswoman-elect Miller. Your role currently as Cook County Commissioner gives you oversight responsibilities to areas like health and hospitals and criminal justice, veterans affairs, contract compliance, asset management, a number of things. Cook County data shows that fentanyl is involved in most confirmed opiate deaths. What would you prioritize currently, and then ultimately, even at the federal level, to help counties sustain declines in opiate-related deaths? What sorts of initiatives, what sorts of approaches would you champion as you move forward in your political career?
Well, thank you. Well, first, let me say thank you on this World Health Day for us to be here together and really representing what the world health looks like. I think, diversity is what matters in all these conversations. And when we have diverse people at the table, then we can actually address some of these issues. So I just want to thank Dr. Vijay for your organization and the Multi-Health Ethnic Coalition and all the work that you all do. And Congressman Davis has been a mentor of mine as well for many, many years. And he said he's the leader, the champion. He really is, and has led the way on so many important health initiatives, probably so many that we couldn't fit them on a list. But they all have led to so many initiatives, not only locally, but globally, literally globally. And that, I look to Congressman Davis as someone that I would want to emulate when I go to Congress. We already have something in common. We're in a small club going from commissioner of Cook County to Congress. So there's what, 5 of us now, 6 of us. So I'm honored to be associated with that number. But I'm also honored to be affiliated with a group that's focusing on healthcare and what it looks like from a disparity standpoint, and how to address healthcare disparities that can be duplicatable. I mean, my whole career, I've been looking at things that if we do something here, that means we can do it someplace else. And all these initiatives are duplicatable. And I look forward to working with Rep-elect LaShawn Ford, who's like a brother to me anyway, on many of these issues. And we've already even discussed how working together, not just for the 7th district, not just for the 2nd district, but working collectively on issues is what's going to move the needle. And that we can focus on that together under the guidance of Congress, because we're going to pick his brain like all the time about everything. And I came from industry. So I came from the biotech pharmaceutical industry. It was my career for 25 years. And looking at how industry plays a part, how nonprofit organizations play a part, government plays a part in making sure that we're building cohesive strategies and initiatives that we can build across the board. That's what I've seen from being a county commissioner, where Cook County is the 2nd largest county in the country. We have the largest public health system in the country, one of the largest public health hospitals. And how do we address patients who don't have the ability to pay and treat them equitable? Because that's always been the thing that I've been focused on as well, even coming from industry. Cook County was one of my accounts when I was in pharma. And at that company, they weren't looked at very well, as far as treating patients with the best possible outcomes that they could get, not based off of cost. And we shouldn't look at cost always as the end goal. It should be what's best for the patient as the first thing, right? Yeah. And I've taken that from a more preventative standpoint. I looked at Cook County Hospital from the time I got there to now has actually changed its philosophy. I'm being more focused on prevention and not just putting Band-Aids on people, and making sure that, okay, great, we have the state-of-the-art wound clinic, but what about making sure they don't get there, and making sure that they don't have to be in the, amputee clinic because now they've lost a limb due to not the best management. So when I look at how all of these are intertwined, it takes, like Congressman Davis said, tables like this, no matter how many people are there, the expertise is in the room. So I appreciate all of your expertise for making what we want to see as a more global view of healthcare and making it stand up for everybody, whether they are able to pay or not able to pay. We should have consistency on that level. So, and I know, Dr. Jackson, that so my grandfather was one of the first Black psychiatrists in Chicago. And the reason I think that's important is because I've done a lot of research on looking at things that were said over time. And what was said in the 1950s and what's being said in 2026 are almost the exact same, which means that we have not elevated our diagnosis of people, especially people of color who need treatment. And we have also not elevated the treatment for people. We might have better drug therapies out there and better ways to access them, but they're not given to everyone. And so I read an article for everybody here who, is Jet Magazine. Jet Magazine was like, oh, yeah, everything was in Jet Magazine. But it was an article that my grandfather wrote, and it was saying, because you said, we were called Negroes then. So it said, Negroes need access to psychiatric care. And that was called psychiatric care because it wasn't mental health, it wasn't behavioral health, and that alone makes a negative statement on why would anybody want that, Negro or not, psychiatric care. So we've come a long way in how we define it and how we define what behavior health looks like, but we haven't come far enough to know that every community deserves the same sort of treatment no matter where they are. And so when I look at this center and what it looks like to treat pain management, I also have a sister who has sickle cell. Sickle cell disease is, mainly in the Black community, but pain management is, my mother had to fight University of Chicago to get a patient bill of rights, which she did get, because a person coming to a hospital with a sick child with sickle cell is not drug seeking. And that's what they were labeled as. My mother was like, if I wanted drugs, I wouldn't come here. I know where to go. And it's not at the hospital for my little 7-year-old child. So that also affects people's looking at healthcare providers is, are you going to provide healthcare for me? Are you going to give me the sort of treatment that I need? So these types of centers, being in a community and have different diverse people at the table is what matters, to get people the treatment that they need, so they're not labeled and they're not discriminated against, and they are getting help. So those are the kind of things that I would want to champion. Here in Cook County, they say that the jail is the best place to go for any sort of mental health treatment, which is unfortunate. That should not be the first stop or the only stop for many. But that means that we're not doing enough good in the communities to treat people. So I would want to champion issues that look at how can we get people treated the minute they say they have a problem, and get them the best treatment, healthcare providers to give them that treatment. And it is it's a layered approach, because getting the best diagnosis is one thing, but then the treatment and the follow-up, that's the next part that many people don't get, because they either fall through the cracks or there is a healthcare literacy component to that. You can't talk to everyone the same. And we've had studies already that say that when people have someone who's of their same community, so if you're an African-American community, someone African-American treats you, you have better outcomes. I didn't think we needed a research to do that, but there's research that says that that's true and that works best. So that's why we also need to train the next generation of providers to be the people in the community, to treat the community. So that's going to be one of the things that I'm going to be championing. So I'm going backwards in a way. So how do we get more Dr. Jacksons? How do we get more Dr. Pep from Inglewood, from Chicago, from our communities to treat in our communities? How is it that we're not telling young people that these are careers they could actually have, and that they could be a radiation technologist, or they can go to school to learn how to be a nurse and have an advanced degree? Most young people don't even know there's advanced nursing degrees. So we need to those are some of the things that I want to work on from a congressional level and from just a community level. Is we need to build the community up from the inside out. And a center like this is exactly what we need to see, duplicating it across different communities and putting them in the communities where they need to be.
Thank you. I'm literally refreshed to hear that. And your rightful emphasis on community level intervention. And I wondered, Mr. EJ, as what I view as the greatest community connection I personally have ever come across.
So I thanks to Congressman Davis. He is the one really made multi-ethnic communities to big centers. He was the one in 2010 told us that you have to be something at the ethnic community. But there are stages and platforms for others, but what do you are? So we really appreciate that time and again. What you have done has grown into national movement, and you have and your constant inspiration, encouragement, and your vision. Yes, let me just conclude with one thing. In April 2021, in India, we were having the second phase of COVID. 4,000 people were dying a day. And I get a call from Congressman Davis. He said, Vijay, we have to do a press conference. I said, Congressman, a press conference? Why? You don't know anything. Just listen to me. Gather all your Indian leaders to come and we'll do a press conference. I said, what, Congressman? No, 4,000 people are dying every day. But we have to do something about it here. So follow my lead. Call all the community leaders from Indian American community to come. And so we met at MedStar Auditorium on May 2nd under his direction, invited the media and the press, and everybody spoke. And that became a global moment, like Congresswoman-elect Donna Miller has said. I mean, Congressman Davis had that vision. We didn't know what a press conference would do. That opened up the minds of everybody. And then after what he started, President Biden and Kamala Harris was able to release the COVID vaccines. If you recall, there was a stock of COVID vaccines kept, and they were not going to, not only to India, to 150 nations. Of course, soon after the press conference was held and all the media put it out, I got a call from Reverend Jesse Jackson, Sr., who just passed, another legend.
And he says, I want to do another press conference too, following up what Danny Davis did. And I'm doing one in Operation Push. And you can come there or join on the phone, because I have the Pakistani community also coming. They want something to be done. So then the next day, very next day, he convened. We went there, and then he spoke to Biden and Kamala Harris, and they said, because of the geopolitical situation at that time, they were not willing to help India because of the Prime Minister Modi. There I can be very transparent because went through. But what Congressman Davis did had a triple effect throughout America. We had visited 10 cities, all with our own finances, own money, with the Reverend Jesse Jackson leading rallies across the country, from San Francisco to New Jersey, right across East Coast to West Coast, and had press conference, press meets, relayed the people. And then President Biden caved in and he gave a statement. We met him at Tulsa, Oklahoma, when they had the Black Massacre, 100 years of that, on June 1st, 2021. And we met him personally and asked him, and then the rest was history. So what I was just saying, things like this, Congressman can tell you thousands, millions of initiatives he has done to change and transform all our lives, not only in 7th Congressional District, globally. Congressman, you are today a living legend, and what you have done in each of our faces, we just cannot express enough. Diversity, inclusion, and equity. What you did during COVID for the 7th Congressional District, he brought $1 billion of aid.
It's incredible.
So, Congressman, it's your turn. From here, where do we go? We'll have Dr. Saldana on side of the pass the mic there.
Yes.
Well, you know what I have found is there are thousands and thousands of wonderful people. It's unimaginable, all of the people who have contributed in significant ways to America becoming what America is. And there are people who wonder why we must fight so hard to keep America moving forward and not allow it to go backwards. And I must confess, from a geopolitical vantage point, that there are efforts and individuals in our country who, rather than moving forward, really want to take the country backwards, who want to take away the freedoms that we have engineered. And this notion of struggle, I was so pleased to see the millions of people in the streets on last Saturday expressing a desire that they don't like what they see. And if you don't like what you see, you ought to try and at least let somebody know about it. And that's exactly what Americans did all over the country. And so I don't think that people do politics just for politics' sake. That politics is a way of life. It's a way of being. I always say that my politics is very much like my religion, that both of them have to do with what I hope the world will become. And I hope that when people are sick, they can get health care. I hope that when people are hungry, they can get food. I hope that when people are disillusioned, they can find solace. They can find peace. And so everything is political from my vantage point. There's nothing, whenever two people interact, I believe some politicking takes place. And if they agree all of the time, then one of them is unnecessary. and so it's a way of life. It's a way of deciding. It's a way of doing. It's a way of hoping. It's a way of everything. I was politicking the other night because Michigan is a little bit closer to where I am than Arizona. And it's all the University of Connecticut. And so I'm pushing for Michigan. I don't know any of the players on either team, but it's closer. It's been a wonderful afternoon. Thank you all so much.
Thank you so much. We're going to transition into sort of our closing reflections. I'll first ask the members of the panel for any comments that you all have just on this topic, any words you want to leave, anything that's on your heart, please leave it with us. And our final reflections will come from Dr. Zaldana, and then final reflection from Congresswoman-elect Miller. So our panel, what's on your heart?
Look into the camera.
After listening to all the expertise, it's such a valuable input you all have given. And my takeout from this session is a holistic approach. We do need immediate care when people come with pain, and that's what the doctors are doing right now. But that's not going to be the end of the pain relief treatment. It needs to follow up by the nutrition. Nutrition is so important for inflammation reduction, which is most of the causes of the illness is the inflammation. So the nutrition is really important. Then the preventive methods, we need to do yoga and meditation kind of things to mentally become strong. Also, we need to get engaged in the community programs which are preventative for the kids to avoid drugs and destructive methods of lifestyles. So there are some of the organizations which are helping to prevent these kind of opioid overdoses in the kids, 360 Youth Services and the Kids Matter. I mean, maybe there are other institutions are there within your areas you are living. So get engaged in that and educate people. And especially from my side, from the Global Eye International Institute of Leadership, we would like to promote this kind of educational sessions for more people to be access this kind of education. And thank you, Dr. Vijay, for the leadership, and Congressman Danny Davis for leading these kind of efforts. And Dr. Sadana to facilitate this kind of roundtable for educating people. And everybody, your valuable input, Commissioner Donna Miller, and my sister, Dr. Brandy Jackson, and really, really very enlightening discussion. And thank you, and be happy, be healthy, and for peace.
It's been an amazing, informative afternoon. Thank you, everybody. I wanted to talk a little bit about the prevention, and I think every prevention starts with education. I think it's important for us as parents, as educators, as community leaders, to speak openly about the risks of the opioids or pain medications that are taken. If I think we teach the kids in a younger age and they know the risks, they will make better choices in the future. Even if, for example, some physicians don't have time and, just prescribe something. And I think if we educate our children, they will be able to ask the question their doctors even, is this really necessary for me? are there other alternatives, for example, physical therapy or other things that we can think about before starting these opioids as medications for me? So education goes a long way, and it's up to our doctors, our community leaders, our representatives to make it a norm for parents, for educators to talk about these things, to talk about the risks before it's too late for the next generation as well. Thank you for this awesome, amazing afternoon. Thank you.
Well, thank you to Congressman Danny K. Davis and to our Commissioner and Congresswoman-elect, and more importantly to Dr. Saldana and to Dr. Vijay and everyone here in attendance for a very stimulating discussion on a very important topic. It's good that we are speaking clearly and freely about something so important, and I really do commend everyone here that has to deal with what can be a grim and a very dark place at times that we're shedding some light into. So this was a pleasure and an honor to participate with you all.
Thank you, everybody. The only thing I want to add at this point is what my mentor and best friend, the late John Saldana, used to say: how do you eat an 800-pound elephant? One bite at a time. And that's the way we're going to have to approach substance use disorder problem.
Beautiful.
Thank you, everybody. It's been a pleasure. I'm so grateful to be amongst every living legend in the room. We are truly the boots on the ground. Applaud for yourself for what we're going to do in this country and city. Take a moment to clap for yourself. Take a moment to clap for yourself, because truly, in ending, we are justice. And I said at the table, I've got an acronym for justice. And just picture yourself. Justice unites souls together in countries or cities everywhere. Wow. We are going to go everywhere.
Repeat it one more time. Loud and
again.
Look into the camera for all our viewers.
Again, each and every one of us are justice. The acronym, justice unites souls together in countries, cities, everywhere. That is what we are, and that is what we're going to do around the world for this condition of opiate dependency and everything else that comes our way. We are the boots on the ground.
Okay. Yes. So, as the current executive vice president of the American Association of Multi-Ethnic Physicians, it's my honor to announce a new award that will be presented annually at the AMAC Annual Congressional Global Champions Gala, starting in 2026. Do you want to repeat the whole thing? Okay, right. Sorry. As the Executive Vice President of the American Association of Multi-Ethnic Physicians in the United States, it's my great honor to announce a new award that will be presented annually at the AMAC Annual Congressional Global Champions Gala, starting this year at our 15th annual gala. It's the AMAC Institution of John Saldana Award of Excellence for Health Entrepreneurship, which is in honor of your father. So I wonder, Dr. Saldana, if you could say a few words and reflections at this time.
I am really proud of this roundtable discussion. I didn't realize it would turn out to be this well. So I'm extremely happy about that. It goes to Stuart as my role model and my mentor. I thought he was going to say me, but but I understand it's my father. So and also my father, and it's about to be his 3rd anniversary of his death. So it's been a little bittersweet for all of us, but I filled his shoes in a little way, and Stuart's been stepped in as my surrogate father in some ways. Consigliere. And I just wanted to point out one thing about how the opioid crisis started. It would be, you'd have an orthopedic surgery, they would throw you 10 oxycodones, and then you'd be hooked, and then you wouldn't get any more, and then you go to the street. Or, they used to treat pain like hypertension. You throw them a metoprolol, but then you throw them an oxycodone. That's the Sackler family. Okay, so those things have all piled up, and now physicians have gone the other way and slingshotted to not writing anything and becoming too stingy. So some of the people that really need it are not getting it. So one thing we are very cognizant of, I mean, if you have cancer pain and there's a tumor here and you're going to die in 3 months, I mean, you're going to be like, no opioids for you. I mean, there's ways to treat. Certain patients need these medications, but not every patient. But I just wanted to point out the impetus of this problem, and I really thank all of you for participating. And I didn't realize everybody had their own personal version of what we were talking about. So it turned out to be a great discussion, and I'm proud of that. And I think Dr. Gupta. Why do I keep calling him Dr. Gupta? Dr. Prabhakar. I know a Dr. Vijay Gupta, but I don't know. Dr. Prabhakar, Congressman Davis, Congressman-elect, and Dr. Jackson. So we have a great panel of people here, and not to mention everybody else in the room, and my wife, and Stuart, and Namita. I think he's back there. Yep, there we go. And I'm just happy that this turned out so well.
Thank you so much. Thank you for hosting us. Thank you for being such a gracious host. We've been blessed to be here. And I want to give the final remarks today to Congresswoman-elect Miller, just to give us your reflections as, to me, I'm still going to say young physician, representing the best of what we hope to see in our leadership at the highest level. So it's such an honor to be in a room with you. And please share with us any of your closing thoughts.
Oh, just as an aside, she's representing Hazel Crest and Hyde Park.
Yeah, and we have a MAPS Pain Center in
both places.
I know.
His mother had the clinic, Dr. Rita Santana,
Okay.
way back, and she gave me the clinical lab at that time.
Well,
My sister lived in Hazel Crest.
that's excellent.
My sister lives in Hazel Crest.
Your sister, my soror, yes.
It's a small world.
It is, yes. Well, I just want to say thanks again for everyone being here and putting this together. And what a great location, what a great focus, what a great plan that we have for the future. And I know that through Dr. Vijay and his organization, that you're always focused on the youth as well. I know you give a young person award at your event. So I want to just encourage everyone that next time we're in a room like this, that we duplicate ourselves with a young person in the room, and that we bring someone that we want to bring, the next Dr. Jackson, the next clinic so that they can see. They need to be sitting right here with us. Each one of us knows one of those people. And I've been around at different organizations saying that because the youth are disenfranchised for whatever reason. And it's our job to bring them back into the fold because they are the future. And the ones who want to participate will. And the other ones, we hope we can encourage them to at least do something. But I love a room like this, and I want to see rooms like this with a young person sitting right next to us.
You mean yourself?
All right. Well, with that, I just want to say, I keep forgetting. With that, I want to thank everyone for joining us today. It's been a true honor to be in the presence of such wonderful souls. And we invite the audience as well to think about their own community work and how best to serve within their sphere of influence. So thank you for being with us today.
Thank you. Thank you very much.
Huge thanks to everyone who tunes in to Dr. VGP's podcast. We've received the YouTube Silver Play button for reaching 100,000 subscribers and counting. We sincerely thank you for being part of this wonderful journey with us. Click on the subscribe button and hit the bell icon to notify you with all our future podcast contents. Thank you again.
Dear viewers, elevate your business to new heights and reach 35 million potential customers with Global Eye Digital. Contact us today at globaleyedigital@gmail.com or info@globaleyedigital.com. Let's take your business global.
Welcome to the future of medical science. At Soft Landing Labs, we go beyond the basics of drug confirmation and quantification. Using advanced LC-MS/MS technology and our own proprietary software, we deliver accurate, fast, and meaningful results. We're the only lab offering color-coded reports and a web platform with medication tracking and drug trail interpretation. Our personable professionals, ethical practices, and 24-hour stat testing mean you're never left waiting. From doctor shopping alerts to provider video support, we've thought of everything to help you stay compliant and informed. Soft Landing Labs. Accuracy, innovation, care. Soft Landing Labs, your trusted partner for drug-free communities.
Fusion Systems and Services, a powerhouse in innovation, delivering transformative technology solutions. With our groundbreaking cloud-ready product, ITIS, leading the industry as the ultimate RPA solution, trusted by top global enterprises. From mobile application testing to middleware automation, from big data integration to SAP automation, and even Salesforce automation, Fusion Systems is your strategic partner for success. No challenge is too big. No system is too complex. Empower your business with Fusion Systems. Visit us now at fusionsystemsinc.com and revolutionize your future.